Our next speaker is Dr. Edward Bartlett, who will discuss women's health research and the big lie. Dr. Bartlett is the president of the Domestic Abuse and Violence International Alliance. He has a Bachelor of Arts in Sociology and a PhD in Public Health from Johns Hopkins University. Over the years, he's worked as an Army Medical Corpsman, community health educator, professor of public health, risk management consultant, editor of an international peer-reviewed journal, and most recently for a regulatory agency at the U.S. Department of Health and Human Services. Please welcome Dr. Ed Bartlett.
Good evening. We're going to return to the theme, the broader theme of health that Dr. Stevens initiated a few minutes ago. And we're going to be talking about women's health research and the feminist big lie. So for years, literally going back to the 1990s, people have been claiming that women were shortchanged, routinely excluded from medical research. This is a 1993, next slide, please, a 1993 editorial in the New England Journal of Medicine, which is one of the leading medical journals in the United States. Quote, "There is little doubt that women have been systematically excluded as subjects for study. It is not surprising that most clinical trials have been heavily, if not exclusively, weighted toward men." That was the statement in the New England Journal of Medicine. Other persons I'm not going to read, but similar statements were made by other leading persons, again, in the 1990s. Next slide, please. So let's fast forward to last year. Jill Biden announced a new White House initiative focused on women's health research. Quote, "This has been underfunded for decades." Where have we heard that claim before? And so here, $731 million allocated for this White House initiative on women's health. Next slide. So, and this is part of the article that appeared in Fortune magazine. This is a screenshot. It's exactly what it said. Women's health research is consistently underfunded. Research, quote, "research on women's health has been underfunded for decades," Jill Biden said. "Many conditions that mostly or only affect women or affect women differently have received little to no attention." All right. Well, that was the claim made very recently in a well-respected magazine. So let's now, those are the claims. Let's now look at the data. It turns out the data tells a very different story. Well, let's start off with what's referred to as the lifespan gender gap. Lifespan gender gap, and this displays practically every country in the world. And you can see on the left side, that's the life expectancy of women. On the bottom aspect, that's the life expectancy for men. So, for example, there's a dot, and I'm actually going to point it out here. So there's a dot right here. Sorry, right here. So you can see there's two dots. One is labeled Russia. In Russia, the lifespan gender gap is 12 years. 12 years difference in life expectancy. The little dot right next to Russia is, guess what? Ukraine. Ukraine also has a lifespan gender gap of about 10 years, 10 to 11 years. But most countries are not that extreme. It's in the United States is a 5-year lifespan gender gap. And that's sort of the average that we've seen around the world. But in not a single country, again, not in a single country are men outliving women. Next slide. So this is an article that I wrote. It was published in a leading epidemiological journal, published in 2001, that simply asked the question, did medical research routinely exclude women? So the whole point was to actually look at the data, look at the evidence. The link is right there on the slide. So let's go to the next slide. So one of the tables from this article looked just at epidemiological research, not drug trials, not social behavioral research, just epidemiological research. And this is using a database called Medline. Medline is considered the best source of data on medical research. So the first column is the different diseases. These are many of the leading diseases in the country. The second column is how many in this time period, this is 1966 to 1990. So this was before any quote corrective measures were taken. How many of those studies had male participants? How many of those studies had female participants? You can see the totals in the bottom row there. Totals, you can see there were more studies that had female participants than male participants. Again, this is back from 1966 to 1990, going back quite a period of time. Next slide. So as a result of hearings held in Congress on this purported exclusion of women from medical research, a new law was passed in 1993 called the NIH Revitalization Act. And part of that act required the NIH to track the number of male participants and number of female participants in all NIH funded research. So that was law passed in 1993. 1994 was the first year they actually had this operational. Surprise, surprise. Turned out all NIH studies, extramural, men represented almost 45% of all enrollees. Women, almost 52%. Surprise. 3.3% unknown. Well, that's some very interesting data. Goes back to 1994. Next slide, please. So 2001, I did a report. I have a copy of it here. Be happy to, it's online. Looking at the whole, not just NIH, but looking at all of Department of Health and Human Services, which is where I used to work, looking at the budget, sex-specific research budget for men's health and women's health. You can see right there the conclusion, a 5-to-1 disparity favoring women's health over men's health. Keep in mind, it's men who are dying 5 years earlier, and in every other indicator are lagging behind women in terms of health status. Next slide, please. So let's now fast forward to the present time. So it's called the Office for Women's Health in the Department of Health and Human Services. And very recently, they issued this report that lists, the top part lists all of the offices for women's health in the U.S. Department of Health and Human Services. You can see there's 8. Now, if you look at the very bottom there, kind of small print, offices and administrative entities within HHS that focus on improving the health of men. Can any of you see that, what it says there? Office of Indian Men's Health, parenthesis, not yet staffed or funded. Isn't that a little bit ironic? But that was the report that we recently discovered. So going to the last slide here. So we're going to be candid here. We're going to call this not just a misrepresentation. We're going to call it not just a lie. We're going to call it the big lie. Because what is a big lie? It's a statement, it's a claim that's made. It's a gross distortion of the truth. It's a misrepresentation of the truth, primarily used as a propaganda approach. All right. So the claim that women were underrepresented in medical research or otherwise shortchanged in clinical trials compared to men is a modern day example of the big lie. Thank you.